welcome everybody. Just a few bits of housekeeping. So we will be recording the session and we ask you all to mute unless you're the current speaker. Feel free to keep your camera on or off, whichever you prefer, whatever you're more comfortable with. I can see some of you are already introducing yourselves in the chat box. That's brilliant. Please pop your name and role in there, and do use it to ask any questions as well. Any thoughts or questions that might occur to you as we go through the session. We're always really pleased to hear from everybody. So if we go on to the next slide, just for those of you who might be new to our webinars, the South West Learning Disability Collaborative is led by us here at Health Innovation West of England, and it's funded by NHS England South West. And the collaborative aims to improve the lives of people with a learning disability in the southwest of England, but all of our webinars and our resources are available open to anybody regardless of location. And if you'd like to know a bit more, or perhaps sign up to our mailing list, there's a QR code there and a link on the slides. We will be sending all the slides out afterwards, so don't worry if you don't catch any of the links on as we go through. And then if we go on to the next slide, Kim. Thank you. So we have a really great agenda lined up today. And as always, we really try to pack in a lot into our lunch hour. So as I said, please do put any thoughts and comments into the chat. And if we don't get to them to answer during the hour or at the end, then we'll try to provide answers in all the materials that we circulate afterwards. And then on to the next slide. Trying to be as speedy as possible so we can get to our first speaker. So I'm going to hand over shortly to our clinical lead, Dr. Alison Tavare. But while I do, just by way of brief introduction to today's topic. So as some of you may know, obesity is highlighted as a priority in the NHS 10-year health plan. And you'll see on this slide, we've highlighted very relevant, nice quality statement, which addresses access to weight management services for people with a learning disability and what should ideally be in place for healthcare staff and carers. So I will hand over now to Alison.
Thanks very much, Susie. So I'm Alison Tavare. I'm a GP by profession and have been leading the South West Learning Disability Collaborative since 2019. So we were really pleased when Justine and Karen asked us to become involved because Justine had got the funding for this work. So
hi everyone, I'm Karen, and I won't go through everyone's name because for timing reasons, but you can see the name of the team that were involved in developing this e-learning on the slide. Next slide, please. So just as an overview of what I'll cover, I'm going to really quickly run through the background to why we developed the e-learning, as Justine has very comprehensively discussed this. I'll give you a brief overview of how we developed the e-learning, a few findings from the research that underpin the e-learning, but I won't go into too much depth because there was just so much that came from the research. I'm then going to go through the structure of the e-learning and I'll share with you a video clip. And I then have some slides on kind of some practical stuff about how to access the e-learning. Next slide, please. And so as Justine mentioned, this was very much a multidisciplinary partnership with academic, NHS, public health and charity partners, and it was funded through Health Education England. Next slide, please. So Justine has already gone through this in a lot of detail, but we know that adults with learning disabilities die on average 20 years younger than the general population. Next point. Next point, please. And just under half of these are avoidable deaths, with heart disease the top cause of avoidable death. Next slide, please. We know, as Justine showed us all that data, that adults with learning disabilities do have a higher risk of obesity. Next point, please. And addressing obesity is really a key priority to reduce avoidable deaths. And the Nuffield Trust, in fact, published a report last year highlighting obesity as one of 5 key areas of focus to close the gap of health inequalities And within this, there were a number of recommendations that were made, one of which was the need for consistent training of health and care professionals. Next slide, please. As Justine has also highlighted, we know that carers are really important to help people with learning disabilities make changes to their lifestyle. This has been shown in the research literature as well. And it was highlighted that there was a lack of training for carers on how to actually do this. Next slide, please. So the overall aim of this project was to develop free, nationally available e-learning for carers on supporting healthy weight in adults with learning disabilities. Next slide. And so I've got quite a few methods. You can just probably put them all out now, yeah, and I'll just go through them individually. So there were 6 main steps to this project. So firstly, we reviewed key online and written professional resources that were already out there to promote healthy weight in people with learning disabilities. We then undertook qualitative interviews with health and social care managers, clinical leads, and commissioners to identify key carer barriers in supporting healthy weight in people with learning disabilities and identify areas that should be included in the training. An initial draft version of the training content was then created, and we then discussed this in discussions and focus groups with paid and unpaid carers to then refine the training. And finally, we worked with the NHS England Technology Enhanced Learning team to design and build the e-learning. And the 2 arrows on the right, I'm just going to show you a few, or the 3 arrows on the right, I'm going to show you just a few findings from these steps. And I'm going to show you how the final e-learning is structured. So next slide, please. I just also wanted to mention that during this project, we collaborated with the Brandon Trusts, specifically with the Brandon Adventurers, who are a panel of experts by experience. And we worked with them to create lived experience videos that are included as part of the training. And I'm going to show you one of those videos at the end. Next slide, please. So there were a total of 25 individuals who took part in our research, and that was across 19 interviews and 2 focus groups. We had quite a range of participants. So the biggest group included social care managers, but we also spoke to healthcare managers, paid and unpaid carers, both NHS and local authority commissioners, a public health professional and social enterprise staff. And we had people from across the Southwest, from both urban and rural areas in the Southwest. We also had some individuals from the northeast of England and 2 individuals who held national roles. Next slide, please. So some of the themes that came out from this qualitative work, from these interviews and focus groups, were around the challenges for healthy weight in adults with learning disabilities, how to define success in terms of weight in people with learning disabilities, the role of carers in supporting healthy weight and the challenges that they experienced, as well as carer training needs. And I have previously presented on these themes, and just in the interest of time, I'm not going to focus hugely on them. I'm just going to show you a bit more information on number 4, the carer training needs. So next slide, please. So there were 3 key areas that were highlighted in terms of the training needs. So firstly, it was felt to be important to start off by presenting some simple facts and figures about the health inequalities in people with learning disabilities and just how obesity impacts on health, because it was felt that this actually wasn't well known. And secondly, the basics of healthy eating and physical activity. Again, it was felt that the carer population, and in fact the general population, don't have a great understanding of these basics, and so this then doesn't get passed on to the people who are being cared for. And next slide, please. And then finally, drawing both of these areas together to think about how to apply this knowledge when supporting a person with a learning disability. Next slide, please. So I just want to show you the structure of the e-learning. So those 3 main areas of need that we identified is how we actually structured the e-learning into 3 bite-sized, roughly 10-minute sessions. So the first one is entitled Overweight and Adults with Learning Disabilities. The second one is The Basics of Healthy Eating and Being Active. And then the third one is more of that practical stuff. How can I support an adult with a learning disability to eat more healthily and be more active? And within each of these sessions, we have a roughly 2 minute lived experience video that's embedded within each. And I'm just going to go through each of these and just show you a screenshot from each of these sessions next. So next slide, please. So in the first session on overweight and adults with learning disabilities, the topics that we cover in this are what overweight means and what causes weight to increase, why it's more common for people with learning disabilities to be overweight, and why it is important to support adults with learning disabilities to work towards a healthier weight. Next slide, please. This is just a screenshot which the amazing team at NHS England Technology Enhanced Learning developed. It just shows you there's lots of colourful images. It's not just text. It's really well designed. Next slide, please. And so the second session was around the basics of healthy eating and being active. And so within this session, we cover the different food groups, why they're important for health, what one portion looks like for each food group, how to make healthier choices and use food labels, some tips for meal planning, and then also why being active is important for our health and ways to move more. And next slide, please. And so these are just a couple of examples of some pictures we've got in here. So we've got some lovely images from the Carolyn Walker Trust, which show just some examples of what meals could look like. And then we also have a real live meal plan that was developed by a person with a learning disability and their support worker, just as an example of what they had put together, which is really nice. And next slide, please. So the third topic is the third session is around is the practical stuff. How can I use this knowledge? How can I support an adult with a learning disability to eat more healthily and be more active? And so within this one, we do cover assessing mental capacity, which Justine alluded to earlier, and how that relates to decisions about weight, food, and being active. What is realistic and appropriate to achieve in terms of weight loss, challenging eating behaviors, and some strategies and discussion around how to support with some of these, and ways to improve opportunities for people with learning disabilities to make healthier choices. Next slide, please. And so this is an example of a screenshot from the third session, which is around the sort of challenging behaviors or behaviors of concern around food, and it gives a bit of a case study. And this was drawn from the interviews from people who we spoke to. So this was based on the challenges that carers themselves found in practice. And next slide, please. Yep, so the next slide, we're going to share with you one of the lovely videos from the Brandon Trust.
Is that working for everyone?
It's working, thanks.
Great.
It kind of slipped when I was like drinking concessively, smoking, eating like all of the pasties, all of the sausage rolls, all of those naughty foods, and I was basically in a rut. Didn't want to go out anywhere, and it was challenging.
Because I put on over, so it was difficult to roll her at night. It was a lot of weight was on Zoe's legs, and they were very heavy. They used to be really puffy and flaky, as you can imagine. They used to be very dry, her skin in general. It was your decision, wasn't it? Yeah. She said she wanted to lose some weight. So.
I love my food. One bit I really like is pasty, sausage roll, crisp, pizza, donut.
But does that food like you?
No. Sometimes I do get a good weight, like that. Sometimes I go like that, and then sometimes it goes down and then up and then down and up. I diabetic, I've got heart problem, sore under my arm, sore leg.
It's mainly the positives were a little better offhand, and I wasn't eating loads of vegetables and fruit like I should be. I stopped eating that altogether. I stopped having breakfast. Yeah, it just wasn't good. Most of it was me being grumpy and me putting weight on and keep putting on and not be able to do anything. I just felt bad with myself for letting myself go through that and not actually asking support to help me, because every time they tried to help me, I used to get angry with them. I used to snap at them when they were trying to help. They're just trying to get me to understand more. Like they're trying to suggest healthier options, and at that time I didn't want to, and I snapped.
14.
Brilliant. Thank you so much. So that's just the first of 3 videos. So within the training, you can see their journeys as they progress and the support that they've had and the changes that they made, and they're really lovely. I think they're the best part of the learning. So I think we can come back to my slides now, and I'm just going to talk a little bit about how to access the e-learning through the platform. Yeah, okay. So the e-learning is set to public access on the Learning Hub, and I see that Kim has put the QR code on there, which is brilliant. So this means that anyone with a general account can access it, so you don't need to have a full account. And you can create a general account by registering with any email address. So you don't need to be an NHS staff member. You don't need to have a work email address to create a general account. You do need to create an account though, so that you can access the e-learning. So I've just put together a few screenshots that show you how to do that, which you'll have in the slides after. Right, so next slide, please. So you start off, so I've just gone page by page, and on the e-learning platform, it asks you to register, and it tells you then what the required information that you need is, and that's it's just so the email address, the country, and current role. You don't need to have a professional role there. You can tick the option of carer. So if we go on to the next slide. So you have to enter your email address. Don't worry about the little bit of wording that says about a qualifying work email address. That's only for the full accounts. Just use any email address when you're creating an account. And next slide, please. And this just tells you that that if you do have a qualifying work email address, you can have a full account and access all other types of resources. But it says that it does allow you to have access to the learning community resources as a general user. Next slide. It then asks you to add your personal details. Next slide. And to search for your country, so you have to enter your country. Next slide. And it asks you to select your region. And then to search for your current role. But again, so for example, I put in the term public, and all of these things came up. So it doesn't have to be like a professional work role. So you could select public carer public, for example, or parent public, for example. Next slide. And then it just asks you to check your details. So check that the information that you've entered is correct. And it then creates a general user account for you and tells you success, you've created an account. And you then get an email address an email that has your username and link to create a password, and you're then able to log into the system, and you can access any of the resources that are set to public access, including this e-learning. And I think that might be it. Yes, that's everything from me. Thank you very much. I'm now going to hand over to my colleagues Rachael and Olivia. Rachel's a dietitian, Olivia is an occupational therapist, and they're going to talk to you about sort of putting some of this work into practice in one particular area.
Thank you, Karen. Hello, everyone. Can you hear me okay? I'm hoping that means yes.
Yes.
Oh,
Fine.
goody, thank you. Always a relief, everyone, to be heard. So thank you, and it's joyous to be part of this today. So next slide, please. I am Rachel, so I'm on the left-hand side of this slide. So you might be thinking, who on earth are we? So we thought we'd share a slide with members of the team from the work that we're doing. So my name is Rachael Colley. I'm a registered dietitian. I've been a dietitian for 25 years. 23 of them I've been working in the NHS. Mainly in Swindon and Wiltshire, so there may be a few familiar faces online at the moment. So I've worked in weight management, I've worked in learning disabilities, I've worked with long COVID. And now, however, I'm a freelance dietitian. So hence I'm able to work with Sport for Confidence, and this is part of that, and I'm delighted to be doing that. I also, just in case it's interesting, I work, or I'm a volunteer for the British Dietetic Association, and I work with their learning disability subgroup, and I'm the education officer for that group. And as well, I have facilitated training for dietitians on behalf of the British Dietetic Association with regards to assessing capacity regarding diet, weight and health. So I have a real investment in the work that I'm doing here with the lovely Victoria, who I can't see, but Victoria,
I am here. Hi, I'm Victoria. I'm an occupational therapist. I'm also a sensory facilitator. I'm based at Sport for Confidence at the moment, and I'm not sure if you're familiar with Sport for Confidence, but we started by adding an occupational therapist in leisure centres to make physical activity more accessible to those with learning disability, mental health, physical needs, anyone furthest away from sport. And that's progressed onto us looking further afield as physical activity and looking more at how we can support someone's overall well-being. Alongside us, we have Kate. She's a specialist wellbeing and public health officer for Essex County Council. And Rachael, who is our health and wellbeing mentor. She specialises in education and teaching around cooking, meal prep, and everything fabulous like that. Next slide, please. So this started because Essex County Council released a 10-year approach, and it has three main outcomes, and that's the healthy weight environment in Essex, more people with excessive weight effectively supported to be a healthy weight, and healthy lifestyle behaviours are easily and more accessible. And it focused on 7 priority settings. So that's school and food, public estate, travel, green spaces, nurseries, early years, food hospitalities, supermarkets, and business and workplace. And then it focused on 6 priority cohorts, and we focus on those with physical and developmental conditions and learning disabilities. And that's basically what we're aiming for. We decided that the best way for us to target those with learning disabilities was to focus on those in more restrictive environments, such as care homes, and target the carers working in that sector. Next slide, please. So this is our pilot that we're part of. We're very lucky to be part of it. It seems a little overwhelming as we go through it, but we'll try and make it as clear as possible. So we already know that there is a need for more education, more weight management services, and more advice for people with learning disability. So we knew that we needed to make a better dietary intake, improve weight management services in Essex, and improve overall well-being of those people with learning disability. And we really want to aim to the prevention of secondary conditions, such as mentioned, the heart disease, and those that are leading to an earlier death. So we had a listen and learn in phase 1, where we created a survey and sent it to over 200 care homes in Essex. We held online drop-ins where carers could turn up, voice their concerns, tell us in a real nice and safe environment what the issues are. We had interaction at the leisure centres, so we work in over 12 leisure centres in Essex. Lots of our participants do have a learning disability. Many of them come with care staff. So just having that real organic conversation about finding what the issues are and just taking it one step further than the e-learning for health module. We then created a training program for phase 2, and this is where we took the main themes from the listen and learn phase and we analysed a further training program. Our main focus is to empower the care staff and address the concerns that they are raising. They have such a broad scope of knowledge that to cover all of that and work from a real carer approach was important to us. We're going to start moving on to the next phase of our pilot soon, which is the in-house practical training. This is where we bring further mentorship into the home. So we're looking to bring our dietetic and OT interventions into the home. We're looking at doing some sort of fun, come dine with us celebration. We're creating a recipe for wellbeing book and really targeting more individualised support for those that have more complex needs. Throughout this programme, we are doing evaluations. So that's evaluation forms, case studies, reports and reflective practice. And so at the end, we can really provide a beautiful overview of what we found. Next slide, please.
That's back to me, thank you. So I just wanted to say a few words about the training programme. So if you start on the left-hand side of the screen, with the preparation of the programme, that's where I was heavily involved, and just thank goodness for e-learning for health. So we referred to that a lot. So thank you so much, because actually starting from scratch, it's really quite tricky to do. As Victoria said, we use themes in the training from Listen and Learn, and the real focus was on the carers who day in, day out are working and supporting adults with learning disabilities. So we really focused on them and what do they need to know and understand for their role. Just to reiterate, as you can see, it's a real collaboration. So Victoria and I worked together, an occupational therapist and a dietitian, and we've had fun, as I hope you can see. And we keep saying we're audience focused. So we really did sort of drill down, and in the 3-hour presentation that we had available, we thought, okay, 3 hours is actually quite a long time. It can't all just be listening. So there's got to be practical elements. We did use e-learning for health, but there is so much in that. We could have filled a day of training, if not a week, but we had 3 hours. So we hoped to make it very practical, very a safe space. I think that was a key thing. Make it a safe space so that the carers who came could feel safe to spark ideas off each other and just think and have that space to ask questions. So the presentation itself, as I've said, was 3 hours. As you might have gathered, well, you might not have gathered, I'm in Wiltshire, and the training was in Essex. So we did have a live link where I was ready for any questions and answers. But it was there were practical sessions within the training, especially to guess the number of sugar cubes in certain drinks, which went down very well, I can tell you. Looking at the top of the slide, capacity focus, yes. The e-learning for health is brilliant. A lot of information in there. But as we went through the training, we tried to keep, as I say, we thought about the audience a lot. And so after we'd done some delivering of what to eat and maybe what to reduce and why, we were mindful that carers would, if they didn't sort of call out to us, they would have been saying, well, it's their choice, it's our client's choice, so what can we do? And then we led into information about thinking about capacity. So we did use the Learning for Health slides, and I hope that we empowered them to think, oh, hang on, if I'm noticing some behaviours, or there's precedent, or there's a previous diagnosis, should I as a carer be thinking, oh, is it a capacity issue? And then as designing the training program, we were very mindful that if it is a capacity issue, then actually it opens up a whole can of worms in terms of all health professionals and social care professionals. We all need to be working together holistically and with the same understanding, which as a dietitian, I mean, I train dietitians, but I'm very aware as a dietitian as well. Unfortunately, I encounter social care, social workers, and some in social care saying, no, you can't do anything because it's a deprivation of liberty. And so moving forward, we definitely need to get that understood by everyone, so we're all working together. Part of the program as well, in going back to the training, we also tried to empower the carers to think, okay, and this was based on e-learning for health as well, but what could they do in the here and now while issues about capacity are being resolved locally and maybe nationally? You know, for example, who should be doing the capacity assessments? Are you employing dietitians? Are you employing a proper learning disability team? But while all that's being sorted out, what could carers do? So could they rethink using food as a reward? Could they definitely notice behaviours of concern? But then the genius of what we're doing with Sport for Confidence is about thinking about getting people involved in cooking. Victoria, over to you.
So during the training program, we wanted to create a really safe space. We were aware that we aren't carers. We're not necessarily always in that space. So create it to be a really nice peer support group where a carer could come in and say, I've got Jeff, he's having this problem. I'm at my wit's end. My manager's not listening. What could I do? Just having that chat between different care homes and having that organic conversation, sharing ideas, was actually something that probably carers took away a lot more. We're really promoting that blue sky thinking for carers as well. So what would your ideal job look like if you've got someone that does have behaviours of concern? What's your strategies? What's your policy and process? So that was a really nice open space that we didn't expect to happen. Ongoing from this, we've kept the support going, keeping in touch with care homes, evaluation of our own work as well and what else they want to see. We've had a really positive outcome so far. Everyone that's attended the training, it's been across 8 different sites in Essex so far, have all come back with positive feedback of that initial how to change something, how to get positive change. Next slide, please. So the next phase is where we visit the care homes. We're going to start supporting care staff and residents. We're going to start applying the techniques we've learned, the how-to tips and tricks, nudging and grading techniques. We're going to start looking at triggers, behaviours of concerns, and any weight management tips. We've also started to create, following a 2-week meal plan, a recipes for wellbeing book. And this is going to be like a cookbook that's going to have sensory triggers, symbols, advice for carers, some occupational therapy activity to go alongside with it, anything to increase engagement. What we're hoping to do is to get some of our residents with a learning disability to come in and film videos. So it's lived experience that we're sharing with the group. We've added a user guide, so that's going to have a little bit about food sensitivities, food triggers, possible ways to overcome barriers. And our goal is to provide care staff with all the information, anything just to prompt an idea. Oh, I know one of my residents got this, someone's got that. Why don't I try this? Just to support the involvement. And we really want carers to feel empowered. We're hoping to do a celebratory come dine with us. We're hoping to get enough care homes that we can do a fun, reflective engagement where we can say we can all make a plate, give it a go, just a real fun sharing and learning in a way that we create momentum. And if people know what they're eating, then they're going to start being more aware of possible weight management. We're going to look at building a plate of the week. We want to build a community that kind of runs without us. We want to create that learning disability weight management service, and we want to push that forward sort of out into the future. And I think for us, it's just knowing what does come next. Next slide, please.
Well, I hope you're all listening going, wow. When I heard Victoria saying all that, it really is wow, honestly. And I'm just delighted to be working with Sport for Confidence on this. It is wow. Already. So thank you, everyone. Oh, thank you. there's claps. Just to say, so this only began in June, so this is really new. This is really new. This is really exciting. Already we're reflecting, as you'd expect us to. Number one, capacity. I think I've probably said my piece already, that we need all across the country. We need to be working together. These are big issues, but we need a holistic involvement. Everyone being enabled, educated, enabled, and empowered to play their part. One of the big things I think we both think that we are trying to do is point number 2 is focus on changing the narrative around meal times and around meals for those who are being supported. So rather than, in my experience, often meals are, well, that's quick because they're going to do something else, or they've got to get on, in the minibus to go somewhere else. So the focus is never, it seems, or sometimes not, on the meal and the mealtime, and empowering everyone to play their part. So as you heard Victoria saying, we're trying to reduce barriers or problems. So the sensory elements on the menus, we're mindful and very, I think, quite knowledgeable about things that can go wrong. So we're trying to remedy that. And as a dietitian, I hope that if we can focus on the meal times, then perhaps there may be, if people eat well at meal times, then there may be less need for snacking. There may be more time spent on that, and then less time being bored and need to snack, hopefully. Number 3, allowing people to play their role. We often reflect as a team. We're quite an unusual trio. The 3 of us mainly working on this project, and we often giggle away and delight in that. And I'd like to say thank you to Sport for Confidence, because they're allowing me to be me and be creative. And we often say it's a pilot when we're saying, can we do this? Can we try this? And we're going, yes, we can. And it's absolutely joyous, and I really hope that we will help to make a positive difference in what we're doing. Victoria, you're on 4 and 5.
Okay, so I think something that we didn't really expect that has come out from this is these further opportunities. So we've been looking and linking with the primary care networks and annual health checks, and it's actually allowed us to go to Essex County Council and ask them for funding for accessible scales. We're hoping for 12 across the leisure centres that can then be used by the local primary care networks. We're linking with larger community groups, and we're building organic relationships with staff who are often emailing and asking for advice and things that are really lovely that we didn't expect we would be a part of. I think definitely for me, it's a little overwhelming that this is actually just the beginning, and we're just touching the tip of the iceberg. Yes, we've created a training program to support that of the e-learning for health, but actually this is a nationwide issue, and it's just knowing how can we keep this momentum growing. And this is a topic that's much bigger than us, but we're having fun while we do it, and definitely we've worked out that there is a need, and just getting people engaged and motivated and empowered while having fun, I think, has become a little bit of our ethos. So that's us at Good Food, Good Moves.
Thanks very much, Rachel and Victoria. That's been absolutely brilliant and a great overview of how this training can be put into place. And thank you, Justine, for giving us all the background why it was important, and Karen for the very practical aspects of delivering the training. So we've got time for perhaps one question. I can see there's one on Prader-Willi syndrome, which I might put to you, Karen. But in the meantime, we will be sharing the slides afterwards. We're also developing a YouTube channel, so we'll be sharing some of the resources on there. And if we'll put the slide for that in the feedback. I'm always, sorry, in the chat, I will always like to end on time. So I apologise if we can't take many questions, but if you do have any other ideas for where people might be able to go for healthy weight in our local areas, if you're aware of exercise that could be done. I know there was a lot of BNSSG, Bristol, North Somerset, South Gloucester did a lot of work on sharing, supporting carers to develop healthy meal plans. Please share ideas. But if we can just take one question, Karen, there was one about Prader-Willi syndrome. For those who don't know what PWS is, that's unfortunately, it's a genetic condition with associated learning disability when people have an overwhelming urge to eat and they're asking for specialist services locally. Do you know that, Karen? I'm not sure if that's something you're involved with.
So the question is, are there any specialist services locally?
Yeah.
There is the Complications of Excess Weight clinic at the Bristol Children's Hospital. Off the top of my head, I don't know what the exact criteria. It is quite tight criteria to be eligible to get in there, but that would be, if anywhere, that would be the place that there would be. So that would be, I'm not sure if it would be on the Trust's website, what the eligibility criteria would be.
Thank you.
But yes.
There's a decision support tool called Remedy, and I can see that Justine's just posted there are hubs for complications of excess weight in Plymouth and Cornwall. So that looks, that could be the one of the ways forward. Thank you. And I've got time for one other question, and I don't know whether who might be able to answer this, but what accessible scales do you use? I'm looking at Karen and Rachel. Do you have any? Do you actually weigh people? Oh, I've got. Sorry, I've got another message.
Victoria will know which. Is it the Marsden? Is it the Marsden scales?
Yes, it's the Marsden 2 lines. I can describe them awfully, like a wheelchair scale that we can then wheel up someone if they are in a really highly specialised wheelchair. We just found that a lot of our local PCNs will send them to a hospital for weighing. We have one lady who hasn't been weighed in 3 years because she can't attend the hospital. It's too much of a chaotic environment for her. So we're bringing the scales to her.
Thank you. That's helpful to know. That was actually in the Royal College of GPs discussion group this week, so I'll be able to share that. And then actually, apologies for missing this question. I've got written to come up twice. What resources are commissioned for people with a learning disability and obesity who can't access mainstream tier 2 weight loss services such as Weight Watchers? Any things? Rachel?
Yeah, I think very sadly, very little. So I very little. So I used to work in Swindon. I was the specialist learning disability dietitian until the funding was axed. So there's funding. So it's really tricky. We need to liaise much more closely with commissioners and allow specialist support. I've gone and forgotten the question, sorry.
It was about commissioning tier 2 services, yeah. So thank you for that.
I think it's very patchy.
I worked on the Obesity Health Alliance report, and it's very patchy. There are good bits here and there, but it is here and there.
Thank you. And then
many things. I know people are saying about Slimming Well and other things. They're not accessible. And absolutely, it's discriminative. Yeah.
Yeah. Unfortunately. Yes, and I've got Julian, who's a local GP, spoken to all the tier 2 management services. They claim they can make reasonable adjustments. Claiming is one thing, whether you actually deliver it is another issue, isn't it?
I've worked in tier 3. It's just no.
Yeah. Well, thank you very much indeed. And thank you also, Justine, for also highlighting the weight loss drugs. We've certainly had some discussions on that and what the place is for Prader-Willi and how people are being monitored, how they'll be able to have some of the weight loss drugs. So thank you, everybody. We will collate some of the questions. I can't promise to give all the answers, but thank you earlier for somebody answering about, I think Susie, about accessing the training. It's the same hub for carers as you use to access the Oliver McGowan training. So thank you very much to everybody. We have got another webinar coming up fairly soon on health screening people with a learning disability. We're not quite sure of the date, but I think it's probably going to be late October. So please join us for that, and please share the links. And please feel free to join the Learning Disability Collaborative, because then we can let you know of other webinars coming up in the future. And please share this with all your friends and colleagues. Thank you very much indeed.